Good morning, everyone. The title of my talk is Use of Mixed Methods in Urban Health, Example of Medical Marijuana Dispensaries in Health. And I hope this presentation will add to this discussion we're having about innovative use of data. Can everyone hear me okay with this mic? Okay. I'd first like to acknowledge the National Institute on Drug Abuse for the grant support, as well as a great team of colleagues out in Los Angeles at Children's Hospital Los Angeles, where I used to work, as well as a outstanding group of doctoral students here at Drexel that were involved in all stages of the analysis that I'll be presenting. So just a quick overview. There'll be a brief background. I'm going to be covering about 3 research questions, doing some mapping of the medical marijuana dispensaries, and then discussing some both qualitative and quantitative data, and then give a summary with implications. So the background of the presentation is that marijuana became legal for medical purposes in Los Angeles in 1996, or excuse me, California. And Los Angeles has since developed what I would say is the largest community of medical marijuana users in the country, with many, many dispensaries. At the time that this legislation was passed, young adults weren't usually on the radar screen in terms of the groups that would be kind of using medical marijuana. So the study is focused on what are the public health effects of this policy on young adults. And we're also interested in understanding what are the implications for dispensaries which essentially sell marijuana for influences on community health. So what are medical marijuana dispensaries? I would argue that they're a new kind of institution in the urban environment. They're brick and mortar structures. They sell marijuana. You can walk into them if you have a valid recommendation, buy different forms of marijuana, different strains. So it's a new kind of thing on the urban landscape. And what do they do? This is kind of the strong version, I think, of some of the positive things they can do. Certainly they can provide safe access to marijuana, so people who are legitimate patients can buy marijuana without fear of arrest. They offer lab-tested marijuana. This is an example of lab testing where you can get the marijuana tested for the different cannabinoids, as well as the safety profile for pesticides. It provides information about the types of strains. Indicas tend to be better for pain, sativas tend to be better for psychological conditions, as well as offering classes, and there can be some possible unintended benefits of dispensaries and perhaps the larger medical marijuana policy. Earlier at the morning session, the epidemic of prescription drug overdose was mentioned, and this was an important article that came out recently that shows in states that have medical marijuana laws on the books, there's actually lower rates of opioid overdose. So potentially the idea of individuals who would otherwise be misusing opioids or swapping them out for marijuana, which is a safer substance. On the other side, there are some potential downsides. There's the concern about diverting marijuana to non-medical users, that there can be destigmatizing of marijuana use that could increase use, and that also there's concerns about increased hospitalizations, hashies, sorry Hershey, but this idea of the edibles being overused, for instance, overconsumed. And in this vein, there are a couple articles that have recently come out that has shown in California that where there's greater density of dispensaries, that there can be more misuse of marijuana and potentially more abuse in general. So that there's some potential ecological impact of dispensaries on patterns of use. So this morning my interests are to kind of ask 3 research questions and try to use some different forms of data to address them. So first of all, where are medical marijuana dispensaries located in the city of Los Angeles? There's no list, publicly available list, so this is something we had to create. Is there a relationship between density of dispensaries and marijuana use among young adults? So is there some kind of ecological effect potentially of where these dispensaries are located and rates of use among our sample? And then what are young adult medical marijuana users learning, or what are young adult marijuana users learning from dispensaries about both marijuana and health? So again, we're going to be drawing some cross-sectional quantitative data from the study that I'm conducting. We also have a subsample of young adults, and then I'll also be presenting some mapping data. The study does include a longitudinal component, but we're not going to be discussing that in this presentation. So first of all, how did young adults get into the study? We have two groups. We have one group called medical marijuana patients and then non-patient users. So the key difference between the two groups is that the patients had to be have a current valid recommendation, whereas the non-patients were never to have had a recommendation. So they haven't been exposed to this policy. And both groups had to be active current users. So some brief participant characteristics. The kind of standout characteristic here is that we have a very diverse sample. 75% are young adults of color. Hispanic Latino is the largest group. One distinguishing group factor between the two groups is that patients were more commonly white than non-patients. So a greater proportion of whites have these medical marijuana recommendations. And just a little background on their overall health. You can see the patients in all cases have greater lifetime histories of this full range of both physical and psychological problems. And so to some extent, and compared to the non-patients, so in many ways this for us indicates that these are in fact legitimate patients, that they have a true need and use for medical marijuana. But interestingly, a high proportion of the non-patients also have report some of these same conditions. So here's the first research question again. Where are medical marijuana dispensaries located in the city of Los Angeles? So I'm going to be using some dispensary data that we collected for this part. So just a little bit of the background. Los Angeles has had, there's hundreds of dispensaries open in the city of Los Angeles, and prior to 2007, it was kind of getting to a sort of an out-of-control situation. So there's been a couple of measures that have been passed to try to rein in the number of dispensaries. So all said that currently there should be approximately around 100 or so dispensaries operating in LA, and these are what I call pre-ICO, or they're the legal or the conforming ones. So how did we do this? So despite the fact that there's supposed to only be around 100 dispensaries, the study team, we went to a publicly available website and found that there were actually about 500 or so that were listed and open in the summer of 2014. Then the team painstakingly went in using a variety of other websites, in fact sometimes called the dispensaries. Nothing was purchased as far as I know from those conversations, but found that only 340 of them were in fact open. So that's sort of the baseline. When we began our research, we estimate that there's about 340 dispensaries that were open and operational. And so that's probably a conservative estimate because some suggest again that there's 500 or 700, but this is sort of our estimate based on this data that we extracted from weedmats.com and then validated through these other means. So this is the first map. The kind of the takeaway, well, first of all, this is the city of Los Angeles. The black is the border. Outside the border is LA County, and then inside is the city. And what you'll see is that the red dots are the non-forming or illegal ones, and the green triangles are the conforming ones. And there's basically a 3-to-1 ratio of non-conforming to conforming ones. And if you lay this on top of a map showing kind of SES in Los Angeles, you'll see that the non-conforming ones locate more in the darker area, which are the poorer areas, and the green and the conforming ones locate more in the kind of the lighter areas, which tend to be the wealthier areas. So it's unclear whether this is a good or bad thing, because certainly individuals in poor areas should have access, but right now those the non-conforming dispensaries tend to be located more in the poorer areas. So that's the first question. This is where the dispensaries are located. So the next question is there a relationship between dispensaries and marijuana use among the young adults in our sample? So here we're going to kind of bring together this dispensary data that we collected with some of the data from the project. So this is first a density map, and what it shows is that the dark areas are the where there's high density of dispensaries, and the orange and the yellow are lower density. And just the statistics first show that there's essentially no relationship. The non-patients equally used basically high and low in the past 90 days. The patients, on the other hand, there was about 80% of them had high rates of use in the past 90 days. But when you compare the use in low and high density areas, there's no statistically significant difference. And the maps basically confirm that too. The circles represent higher users, the triangles lower users, and there's basically no pattern when you look at it. This is the non-patients, and this is for the patients. And it's probably more relevant for the non-patients because this gets again back to the issue of diversion. You might expect that patients are using more if they're located closer to dispensaries, but in neither case for the patients or the non-patients. So this is preliminary data, but while the density of dispensaries may be located to other factors, but this suggests that it's not related to use, which I think is important. So the third question is, what are young adult marijuana users learning from dispensaries about marijuana and health? So here we'll be using the quantitative and qualitative data and putting that together. So first question is, where are young adults getting marijuana from? It turns out, not too surprisingly, the patients are largely getting it from dispensaries. Where are the non-patients? Many of them are getting it from friends who procure it from a delivery or dispensary. Some get it from other sources, and some grow it on their own. So this kind of illuminates, and probably not too surprising, but there is diversion from these dispensaries to non-patients. But what have patients and non-patients learned about marijuana from their interaction with dispensaries? Here we can see that the patients across the board have more knowledge about what I would argue are safer ways to use marijuana, more effective ways to use marijuana, more ways to kind of more clearly understand the medicinal benefits for marijuana. And just here's some summaries of some qualitative. Usually I like to include quotes, but since there's so little time here, the kind of the take home for the patients is that they were much more educated and active consumers of marijuana based on, according to them, their interactions and learning from dispensaries about the different types and strains, et cetera. And that they may not go to the closest dispensary because there's better places with more knowledgeable staff, better prices, better secure facilities elsewhere. In contrast, the non-patients, they tended to be less educated. They had less direct contact, obviously, and then the contact that they did have tended to be more with the non-conforming dispensaries, which tended to have more inferior products, less knowledgeable staff. And again, many of them were using for medical purposes, but without really the benefits of the knowledge that could have been obtained through dispensaries. And just one quick example too is one of the patients or non-patients that we interviewed had transitioned between baseline from a non-patient to a patient, and this person stood out as being, in the interview, as being one of the more knowledgeable non-patients. So that we're thinking that, again, that exposure to the dispensary was an important part of their increasing understanding of safe and effective use. So that's a brief summary of the findings, and just what I would say for the implications for urban health and what we're talking about. I think there's valid ways to combine both qualitative and quantitative and new forms of data, and that kind of relying on a single source doesn't give you the most complete picture, and that this kind of triangulation of maps, qualitative and quantitative, can give you a really rich understanding of a phenomena. And lastly, I would say that, over the past 40 plus years, the war on drugs has really positioned marijuana use as bad, and that marijuana users should be locked up. I think what this research and others through these approaches may come to demonstrate is that marijuana, when these dispensaries are regulated properly, when marijuana is used safely, can in fact be play a positive role in urban health.